The CECC has unveiled a blueprint for coexisting with COVID. It will gradually reopen borders starting March, and it will discard its 4-level pandemic alert system after February 28th. Every month, it will reassess and adjust its pandemic rules, giving more weight than before to Taiwan's economic development.
Responding to this new approach to COVID, doctors are urging caution, saying that the nation's vaccination rate is still not 100%. They say that if dangerous variants emerge or if there's a surge in cases of unknown origin, Taiwan should be prepared to tighten controls.
宣布是说现在是开始，要走向一个经济防疫
The CECC is officially retiring its pandemic alert system. Going forward, it will evaluate its COVID measures monthly with an eye to the economy. Border restrictions will be gradually eased starting in March. However, doctors say controls should be tightened again if 2 particular warning signs appear.
What we need to be sure of now is that there are not too many COVID cases with unknown infection sources. We also need to keep an eye on what is happening abroad, since we are slowly opening the border. Business travelers and other regular travelers will be arriving, so if new variants emerge, or if the rate of serious infections increases, then we should temporarily halt our reopening. We don't want new variants to enter Taiwan, so as long as we can't get the vaccination rate up to 100%, this is the best course of action.
The doctor said officials must continue to monitor the virus's spread. If the number of unknown infection sources increases, or if more dangerous variants emerge, border restrictions should be adjusted in response.
We need to keep an eye on hospital capacity and see if the healthcare system is becoming overburdened. We also need to look at the situation in other countries and whether they are experiencing large outbreaks. So it's both the domestic and international situations that we have to base our measures on.
Starting March 7th, international arrivals will be able to quarantine 1 to a home, while contacts of infected persons can isolate 1 to a room. When asked if the new policy may raise the risk of community infection, one doctor said that depended on whether people followed the rules and whether the CECC had a complete set of accompanying measures. Viral load will also affect transmissibility, the doctor said, adding that a high vaccination rate would prevent deaths and overburdened hospitals.
There's still about 10% of the population that is not protected through vaccination and is at risk of infection. The big test is how people in quarantine behave and how authorities manage their quarantine.
The health minister said that both public and private organizations should appoint internal authorities to handle pandemic prevention. But one doctor said it would be more effective to promote rapid testing. Anyone showing symptoms should be tested immediately to reduce the risk to businesses, he said.